If you accidentally touch a blistering hot stove, your body's reaction is just instantaneous panic.
Oh, absolutely. Total alarm bells.
Right. Your skin, which is the absolute frontline armor of your immune system, has just been breached. Emergency alarms go off. But, and here's the paradox we are unpacking today, doctors are currently charging thousands of dollars to deliberately inflict that exact same cellular trauma to your face.
And even to internal organs, honestly.
Exactly. They are hijacking your body's disaster response to fundamentally reverse the biological clock.
I mean, it sounds like science fiction or maybe just a really terrible idea, right?
Yeah.
But this controlled destruction is, it's the absolute foundation of modern aesthetic and regenerative medicine. We are essentially hacking the survival mechanisms of our largest organ.
And that is exactly what we are exploring in today's deep dive into the fascinating science of skin damage, healing, and rejuvenation. We've gathered a massive stack of sources for you.
Yeah, we have basic NHS burn protocols, clinical dermatology guidelines from 2025, and some really breakthrough research on cutting-edge lasers and light therapies.
Our mission is to decode this whole paradox. We want to understand how we treat unexpected skin injuries and why we are now using these futuristic lasers to intentionally reprogram the skin. So we're serving, profound biological shifts like menopause.
Right.
So if we really want to understand how a high-tech laser reverses aging, we have to start at the bottom. We have to look at how the skin naturally deals with a totally accidental severe burn.
Yeah, and the best place to see that baseline is in the medical protocols for an emergency. The NHS and University Hospital Sussex guidelines for an accidental burn or scald are incredibly strict.
Very strict.
Yeah, and they are entirely focused on damage control. Your immediate priority is cooling the tissue under running water for at least 20 minutes.
Wow, 20 whole minutes.
Exactly. Then loosely covering it with cling film to protect the exposed nerve endings and keep bacteria out. And they explicitly state absolutely no butter, no oils, no household creams.
Which is such a persistent myth. You always hear people say, oh, put some butter on a burn. Why is the medical guidance so strictly against that?
Well, because oil acts as an insulator. When you get a thermal injury, the heat doesn't just, disappear the second you pull your hand away from the stove. It actually continues to radiate down into the deeper layers of the dermis, destroying cells.
Oh, I see.
Yeah, so if you put a layer of fat or oil over that, you are essentially putting a heavy lid on a boiling pot. You trap the heat inside the skin, forcing the burn to penetrate deeper.
That makes total sense. You want the heat to escape. And what really stood out to me in these sources is the protocol for blisters. The guidelines say if you get a small blister, like smaller than your little fingernail, you just leave it completely alone.
Right, it's a natural biological bandage.
But if it's larger, a doctor might step in and de-roof it.
Yeah, de-roofing. It means they physically remove that top layer of dead, separated skin.
That sounds so painful.
It's intense, yeah. But when a blister is that large, the fluid trapped inside can become stagnant. It harbors bacteria and prevents the underlying tissue from regenerating. So removing that roof allows the medical team to clean the raw dermis directly.
But the recovery from that is, it's a massive biological undertaking.
Oh, totally. It takes 2 to 3 weeks for new skin to bridge that gap. And that newly healed tissue remains hypersensitive to direct sunlight for up to 2 years.
2 years. Right, because the skin acts like a city's emergency response system. You have a disaster site, so the body rushes white blood cells to clear out the debris.
Yeah, it ramps up blood flow, which causes that intense redness and throbbing you feel.
And crucially, it signals the local construction crew, these cells called fibroblasts, to rush to the site and start frantically laying down new collagen to rebuild the broken tissue.
Exactly. The fibroblast is the hero of our story today. They are the microscopic factories that produce collagen and elastin.
And those are the structural proteins that keep skin firm and tight.
Yes. So in a natural burn, they are just trying to save your life by patching a hole.
So keep that city emergency response in your mind. Because aesthetic dermatology looked at that frantic collagen-building response and asked a brilliant, albeit somewhat unhinged question.
Which is, what if we want to trigger that exact same emergency protocol on purpose?
Right, just to force the fibroblasts to show up and lay down fresh, youthful collagen on an aging face.
And that concept is the underlying mechanism for ablative laser resurfacing. When a doctor fires a fractional CO2 laser at your skin, they are not, buffing or polishing the surface. They are performing a highly calculated microscopic burn.
They are literally vaporizing tiny columns of tissue.
Yes, to trick the immune system into thinking a massive trauma has occurred. It kicks that wound healing cascade into high gear.
And you can see the proof of that in the post-care instructions. We have a post-care sheet here from a dermatology clinic for a standard CO2 laser treatment, and it is almost identical to how you treat a severe sunburn or thermal injury.
Right. The patient is instructed to use ice packs for 10 minutes every hour.
They have to sleep elevated on a mountain of pillows to manage the massive inflammatory swelling. And remember how the NHS said absolutely no creams on a fresh, accidental burn?
Exactly. Well, once the heat of the laser treatment has fully dissipated, the clinic actually instructs you to coat your oozing raw face in a thick layer of petrolatum ointment like Aquaphor.
Because the heat is gone at that point.
Right. In that controlled setting, the ointment is acting as an artificial skin barrier. The laser has destroyed your natural barrier, so the ointment prevents moisture from evaporating out.
And keeps ambient bacteria from getting in while the fibroblasts do their work underneath.
Exactly. And the physical shedding of that damaged tissue is a fascinating process. A few days after the laser, patients report their skin feeling exactly like rough sandpaper.
Like actual sandpaper.
Yeah, because that is the dead, vaporized tissue literally being pushed out of the body as the fresh, newly constructed skin rises to the surface. It sloughs off over 5 to 7 days. It's a controlled demolition followed by a total rebuild.
Okay, so we understand the why. We burn the skin to force it to rebuild itself, but let's look at the actual tools they're using to do this in 2025 and 2026, because the technology is undergoing a massive shift. We are moving away from full demolition toward, incredible precision.
Yeah, to appreciate the new wave of lasers, we have to establish the traditional baseline. For decades, the traditional CO2 laser was the absolute gold standard for severe sun damage and deep acne scars.
And that operates at a wavelength of 10,600 nanometers, right?
Right, and it is fully ablative. That means it indiscriminately vaporizes the entire outer layer of the skin while driving a massive wall of heat deep into the dermis.
And the clinical results are wild. The data shows it yields an average 40% improvement in deep wrinkles.
Yeah, 40%. A 40% reversal of aging in a single treatment. So my immediate question as a patient would be, well, if this traditional laser gets you a 40% improvement, why wouldn't someone just bite the bullet, endure the pain, do the traditional CO2, and be done with it?
I mean, it's a fair question. Why are we seeing all these new, lighter lasers hitting the market?
Right.
There are two major reasons: downtime and safety. The recovery from a traditional, fully ablative CO2 laser is brutal.
Like how bad?
You are looking at 7 to 14 days of looking intensely sunburned, oozing clear fluid, and essentially hiding away from the world. Most people simply cannot put their careers and lives on hold for 2 full weeks.
Yes, nobody has time for that.
But the safety limitation is even more critical. Because that traditional CO2 creates such a massive wave of collateral heat, it is highly risky for people with darker skin tones.
I saw this in the sources. They specifically warn against using it on Fitzpatrick types, 5E through 6. Can you break down what that scale actually measures?
Sure. The Fitzpatrick scale is a scientific classification for how skin responds to UV light, which correlates with the amount of melanin in the skin. Types I and II are very fair skin that burns easily.
Okay.
Types 4 through Psi represent olive to deeply pigmented brown and black skin. In darker skin tones, the melanocytes, which are the cells that produce pigment, are highly active and very sensitive to heat.
So if you blast those cells with the intense thermal wave of a traditional CO2 laser,
They panic, they go into overdrive, and pump out massive amounts of melanin as a defense mechanism. This causes post-inflammatory hyperpigmentation.
oh wow. So a patient could go in trying to fix a few wrinkles and end up with permanent, dark, mottled patches all over their face.
Exactly. The emergency response goes too far and creates an entirely new problem. That makes perfect sense.
And that is exactly what the new wave of lasers in our 2025 and 2026 sources is trying to solve. The engineers need to figure out how to get the fibroblasts to wake up without causing that massive collateral heat damage.
And they actually achieved it. The UltraClear laser is a massive breakthrough highlighted in our sources. It is the first FDA-cleared cold fiber ablative laser.
Wait, gold fiber?
Yeah, operating at a different wavelength, 2,910 nanometers.
Okay, I have to stop you there. Cold fiber ablative laser. Ablation literally means vaporizing tissue. How on earth do you vaporize human tissue while keeping it cold? That sounds like an oxymoron.
It does, right. But the secret is in the speed and the precise wavelength. At 2,910 nanometers, the laser energy is absorbed by the water in your skin cells at peak efficiency.
Okay.
The machine delivers this energy in such incredibly fast microscopic pulses that the target tissue vaporizes instantly before the heat has a fraction of a millisecond to radiate outward into the surrounding skin.
Wow. So it excises the tissue, but the surrounding neighborhood stays cool.
Precisely. It's ablation without the widespread fire.
That is so smart.
And because it drastically reduces that collateral thermal damage, the patient experience is completely transformed. The average pain score reported is just 1.75 out of 10.
That's practically nothing.
Yeah, patients don't even need topical numbing cream. It delivers a mini facelift effect by triggering collagen, but the downtime drops to just 2 to 5 days.
That is way more manageable than 2 weeks.
And most importantly, because there is no massive heat wave, it doesn't trigger the melanocytes to overproduce pigment. It is finally safe for all skin tones on the Fitzpatrick scale.
That is a huge game changer. And UltraClear isn't the only one changing the game. The sources also detailed the CoolPeel, which uses a smart-side tetra CO2 system. Instead of a continuous dragging burn, it delivers incredibly short bursts of high peak power energy.
Right, so you get the surface remodeling, but you only have 1 to 3 days of mild redness.
And then you have Halo, which is a hybrid approach. It fires 2 completely different wavelengths at the exact same time. An ablative 2940 nanometer beam to vaporize the surface, and a non-ablative 1470 nanometer beam to safely heat the deep tissue without breaking the surface.
You're getting the best of both worlds in a single pass.
Yeah, it's wild. But looking at all these incredible machines raises a broader question. Why is there suddenly such a massive surging demand for these highly specific resurfacing treatments, particularly among patients in their 40s and 50s?
Well, we have to connect this to the underlying biological timeline.
Right. It comes down to a very sudden, dramatic biological cliff.
Hmm.
Menopause.
Yeah, menopause causes a systemic shock to the skin's entire architectural foundation.
Our sources highlight this collagen crash that society rarely prepares people for. During the first 5 years of menopause, as estrogen levels plummet, a person can lose up to 30% of their skin's collagen
30%?
in just 5 short years. The skin's barrier function dramatically weakens. It becomes noticeably thinner, much drier, and incredibly reactive to the environment.
And because the hormone balance is entirely disrupted, many women suddenly develop severe adult acne out of nowhere.
And this profound structural collapse is exactly why over-the-counter creams, no matter how expensive or luxurious, completely fall short.
Right. The active molecules in a topical cream are simply too large to penetrate past the skin's outermost layer, the epidermis.
They can moisturize the surface, but they physically cannot reach down into the deep dermis where that severe 30% collagen deficit is actually happening.
Exactly. To fix a cellular collapse, you need a tool that bypasses the surface and communicates directly with the mitochondria inside the cells.
Which brings us to a completely different approach.
Yeah.
We've talked about the controlled burn of the lasers, but let's look at the red light rescue.
Oh, yes. The scientific term for this is photobiomodulation.
Right. So how is this different from lasers?
This is a non-ablative, non-thermal alternative. Lasers rely on microdamage and heat to force the skin to heal. Red light therapy does not damage the skin at all.
Not even a little bit.
Nope. Instead, it uses specific wavelengths of visible and near-infrared light, typically between 600 and 1100 nanometers, to trigger a biochemical reaction inside the cell.
And the data is staggering. One of the clinical trials in our stack looked at a group of women using a red LED mask, emitting specifically at 630 nanometers on their faces.
And the protocol was surprisingly simple, right?
Very simple. 12-minute sessions twice a week. After 3 months, the depth of their crow's feet dropped by 38%. Dermal density, which is exactly what collapses during that menopausal crash, increased by nearly 50%.
That is massive.
And sebum production, the oily substance that clogs pores and causes that menopausal acne, fell by an incredible 70%.
I mean, to see a 50% increase in dermal density without a single incision or microburn is a profound biological response.
So my immediate thought reading those results was, if this specific 630 nanometer light is literally acting like a battery charger for my cells and reversing the aging process, shouldn't I just buy a massive red light panel, sit in front of it for 4 hours a day and never age? Like, is more better?
It is a very logical assumption, but the science definitively says no. The mechanism at play here is governed by something called the biphasic dose response.
Okay, let's unpack that mechanism. How does the cell actually process this light?
Well, inside your cells, you have mitochondria, the powerhouses of the cell. Inside the mitochondria, there is a specific enzyme called cytochrome C oxidase.
Okay, cytochrome C oxidase.
Think of this enzyme as a tiny solar panel. When it absorbs that specific 630 nanometer red light, it kicks the electron transport chain into gear, massively boosting the production of ATP, which is the literal energy currency of the cell.
So it wakes the fibroblast up, hands it a ton of energy, and tells it to get to work repairing tissue and producing collagen.
Exactly.
That sounds great, so why can't I do it all day?
Because of that biphasic dose response, if you bombard that tiny solar panel with too much light, the system becomes overwhelmed. The mitochondria produce too many reactive oxygen species, the energy production bottleneck jams, and the entire system shuts down to protect itself.
Oh, wow.
Yeah, the cellular benefits halt entirely, and massive overexposure can actually reverse the positive effects and damage the cell.
So it's exactly like watering a houseplant. A little bit of water gives it the nutrients to grow. But if you panic and flood the pot every single day, you drown the roots, rot the system, and kill the plant.
That is the perfect analogy. Consistency at a moderate targeted dose is the key, not maximum exposure.
Got it.
Now, if we take this understanding of how estrogen loss decimates the collagen in the face, we have to look at how that identical biological mechanism impacts the rest of the body. Because that 30% collagen crash does not stop at the neck.
It absolutely doesn't. And this leads us to an incredibly impactful but rarely discussed application of this technology. We have to talk about vaginal rejuvenation.
Right. The clinical diagnosis for this is genitourinary syndrome of menopause, or GSM. It's historically been called vulvovaginal atrophy.
And it affects a huge number of people, right?
Up to 60% of postmenopausal women, the sheer drop in estrogen causes the mucosal tissues in the vaginal canal to become incredibly thin, rigid, and devoid of natural lubrication.
And the clinical reality of this is severe chronic dryness, intense pain during intercourse, and recurring urinary tract issues.
It's agonizing, and for decades, the traditional treatment for GSM has been local estrogen therapy, creams or rings inserted into the tissue to replace the missing hormones locally.
But our sources point out a major gap in that care. Hormone therapy can be controversial for some, and it is strictly unsafe for many breast cancer survivors whose cancers are hormone receptor positive.
Exactly. So you have a massive population of women suffering in silence with daily pain, with zero viable hormonal options.
Which is awful. But this is where the aesthetic laser technology crosses over into life-changing gynecological care. Doctors are now utilizing the exact same fractional CO2 laser technology we discussed for facial wrinkles and applying it internally to the vaginal mucosa.
Yep.
Okay, I have to be honest. My initial reaction to reading this in the clinical papers was sheer terror.
Oh, totally understandable.
Right. I mean, we spent the first half of this deep dive establishing that a CO2 laser is a tool designed to vaporize tissue and create a controlled burn. The idea of using a tissue vaporizing laser inside an incredibly sensitive internal organ sounds barbaric. How is that remotely safe?
It sounds alarming until you understand the geometry of how the laser is applied. The key word that makes this procedure safe and effective is fractional.
Okay.
If they used a traditional, fully ablative CO2 laser that vaporized the entire internal surface area, it would indeed be a disaster. But the fractional laser only creates microscopic pinpoint columns of thermal damage.
Imagine a grid of tiny dots.
Exactly. Between each of those vaporized dots is healthy, completely untouched tissue.
So you aren't burning the entire mucosal wall, you're just punching microscopic spaced out holes in it.
Yes. And because the vast majority of the surrounding tissue is unharmed, the healing response is incredibly rapid. When researchers look at the histology, the microscopic structure of these tissues after the fractional laser treatment, the results are remarkable.
Those micro-injuries trigger the local fibroblasts to flood the area.
Right. They start pumping out fresh collagen and elastin. The epithelial layer of the tissue literally rebuilds itself to be thicker and more robust. And crucially, the laser promotes angiogenesis.
Angiogenesis, let's define that. That is the biological formation of brand new blood vessels, right?
Correct. The thermal injury demands a blood supply to heal, so the body builds new capillaries in the tissue. This means you have a thicker, more elastic tissue structure supported by new collagen and a massive increase in local blood flow, bringing oxygen, nutrients, and natural lubrication back to the area.
And the tissue is completely revitalized without introducing a single hormone into the patient's body.
Exactly.
And the clinical data on the patient experience absolutely backs up the safety. The studies in our stack show that any transient discomfort from the internal procedure resolves within about 5 days.
Just 5 days.
Yeah. And the patient satisfaction rate is staggering. Nearly 95% of patients report they would undergo the therapy again.
Because it works.
Right. They are tracking this using very specific clinical metrics. Patients see massive improvements in their vaginal health index, or VHI, which measures elasticity, fluid volume, and pH balance.
And they also see dramatic spikes in their female sexual function index, the FSFI, which tracks a reduction in pain and an increase in arousal and satisfaction.
They are literally getting their quality of life back through controlled microtrauma.
It is a phenomenal example of how decoding a core mechanism, using controlled thermal injury to stimulate fibroblasts and angiogenesis, can be adapted to solve vastly different medical crises.
Yeah.
But this entire premise relies on a healthy immune system responding correctly to trauma. What happens when the underlying system is fundamentally broken?
Like what happens when the skin's own immune system turns against itself?
Exactly.
That is the perfect question to transition us in the final section of our sources. The 2025 Dermatology Guidelines for Treating Atopic Dermatitis, which most people know as severe eczema.
This is a massive growing public health issue. The 2025 data shows that a full 10% of adults in the UK are currently living with atopic dermatitis.
That's a huge portion of the population.
It really is. And here's the critical difference. You cannot use a laser to fix this.
Because if you create a controlled burn on skin that is already chronically inflamed, hyperreactive, and actively attacking itself, you won't trigger healthy healing.
No, you will pour gasoline on a biological fire.
Right. We've been talking about lasers as the construction crew we hire to rebuild a deteriorating building, but treating severe atopic dermatitis is an entirely different job.
You don't need a construction crew because there is an active riot happening at the site.
Yes. These new 2025 breakthroughs, these advanced JKK inhibitors and targeted biologics, they are the security teams stepping in to stop the immune system from trashing the site in the first place.
Let's refine that analogy just a bit to match the actual cellular mechanism because it's even more precise. These drugs aren't just security guards physically tackling rioters. They are highly trained operatives sneaking in and cutting the specific radio wires so the riot police never get the call to show up and cause chaos.
Well, I like that. Let's look at how they are cutting those wires, because the level of precision in these 2025 guidelines is wild. For mild to moderate cases covering up to 20% of the body, the primary recommendation is ruxolitinib cream.
Which is a topical JAK1 and JAK2 inhibitor.
How does it cut the wire?
Well, JAK stands for Janus kinase. Inside your cells, you have the JAK-STAT pathway. Think of it as a cellular telephone wire.
Okay.
When an inflammatory signal hits the outside of a cell, the JAK enzymes act as the messengers, running that signal down the wire into the nucleus to say, hey, we are under attack, start causing massive inflammation and severe itching.
And so the ruxolitinib binds to those JK enzymes and physically blocks them.
Exactly. It cuts the telephone wire. The itch signal never reaches the nucleus.
Wow. And if the topical cream isn't enough to stop the riot, the guidelines escalate to oral therapies that systemically block those signals. They recommend abrocitinib, an oral JAK1 inhibitor you take daily, or for incredibly persistent cases, lupadapacetin.
Right. And the goal with these oral medications is to reach what the clinical guidelines call ESI 75 clearance,
which stands for the Eczema Area and Severity Index. Achieving ESI 75 means the patient has seen a 75% reduction in the redness, swelling, scratching, and leathery thickening of their skin.
And for someone suffering from severe full-body eczema, a 75% reduction is a total transformation of their daily life.
And for patients who perhaps cannot take a broad JK inhibitor or who prefer a different mechanism, the 2025 guidelines highlight tralokinumab. This isn't a JAK inhibitor. It's a targeted biologic injection you take every 2 weeks.
And it cuts a completely different wire. It specifically binds to and neutralizes IL-13.
IL-13 is interleukin-13. It is a specific inflammatory cytokine, like a microscopic protein, that is a primary driver of the intense inflammation and barrier dysfunction in atopic dermatitis.
Right, so instead of blocking the cellular telephone wire like a JAK inhibitor, the biologic acts like a heat-seeking missile. It hunts down the specific IL-13 protein in the bloodstream and neutralizes it before it can ever reach the cell to cause damage.
We are literally editing the specific immune pathways to stop the skin from attacking itself.
Exactly.
If we step back and look at the entire landscape we've explored today, it represents a monumental shift in how humanity views the skin. It is no longer just a static biological wrapping paper that holds our organs in place.
Oh, far from it. It
Yeah.
is a highly intelligent, highly programmable, dynamically responding organ.
We've gone from the strict first aid rules of an accidental scald, frantically cooling the tissue to prevent deeper damage, to intentionally utilizing that exact same wound-healing cascade with the calculated microscopic trauma of cold fiber and fractional CO2 lasers. We are hacking the system.
We really are. We are combating the devastating 30% menopausal collagen crash not with superficial creams, but by waking up the cytochrome C oxidase in our cellular mitochondria using precise 630 nanometer red light.
And we are restoring profound quality of life with internal fractional lasers that trigger angiogenesis and rebuild the vaginal mucosa without the need for systemic hormones.
And of course, we are reprogramming rogue, self-destructive immune systems with 2025 cellular-level JK inhibitors and precision-guided biologic missiles.
It is all about sending the exact right instructions to the cells, whether that is through the controlled heat of a laser, the energetic wavelength of light, or the targeted binding of a molecule.
Yeah, understanding the underlying why and how behind the way our skin heals gives us unprecedented power over how we age, how we recover from trauma, and how we manage chronic inflammatory conditions.
Which leaves you with one final fascinating thought to chew on. Think back to that city emergency response we talked about at the very beginning, the fibroblasts rushing in to rebuild the foundation.
Right.
If we can now use specific non-invasive wavelengths of red light to literally instruct our aging facial skin and degrading vaginal mucosa to act decades younger, and if we can use targeted biologics to precisely edit our immune system's behavior down to a single interleukin-13 pathway.
Where does it lead?
Exactly.
Yeah.
How long until we can use these exact same photobiomodulation and cellular editing techniques to regenerate failing internal organs? Could we essentially reverse the biological clock of a failing liver or damaged heart, just as predictably and effectively as we are currently doing to the outside of our bodies?
It's wild to think about, but the underlying cellular machinery is remarkably similar. It is a profound question, and the science is moving toward that reality faster than we ever thought possible.
Definitely something to think about the next time you look in the mirror. Thanks for joining us on this deep dive.